Hello, hello. Welcome to Your Health Matters. Hope you're all having a great day, a great weekend so far. How are you, Elizabeth?
I'm doing okay. How are you?
Well, I'm doing pretty well, thanks. So, without further ado, yeah, let's dive in. This week, folks, a little different this week than we usually do. And I've been thinking about this a whole lot lately because it's in my opinion, very serious subject that we're going to go over today. And I want to talk to you about something that affects every one of us, regardless of our age, background, or our beliefs, and or our financial status, or our financial means, or a whole bunch of factors. The first thing that I want to come across from today's show and the message is that if there was ever a time to get healthy and stay that way, the time is right now. And you know what we're going to talk about. Would you agree?
Yes, I do agree.
Yeah. Now, we usually try to add, we'll talk about some things, negative, this and that, and the facts, if you will, of some of the things going on in the world regarding food supply, big pharma, big agriculture, the medical situation or lack of access, or, just a whole bunch of different things, right? And how convoluted it is, how much greed is involved. But we'll put a positive spin on, which we will do today, but it might not be in a normal format. So what I'd like you to do is brace yourself by prepare yourself by trying to, for these 40 total minutes that you're going to listen to us, open your mind and realize that what we're going to bring at you today is not from either political side. This is a non-politicized show. It's a non-politicized set of data, and it is based on fact and mostly from resources that are far to the right. Now, I can pull a lot from the left too, and they all say the same thing, but because the listener base is mostly right, I decided to go, let's pull from the right from some of the most trusted resources. And all those, by the way, are on my website. When you go to carlstern.com, we'll talk about that in a little while, though, where you can see it exactly. So you can go right there and look at the data, because I don't want anyone thinking I'm making stuff up. I'm not. But if there was ever a time to get healthy and stay that way, and it's right now. Because the way healthcare is funded, the way it's accessed and delivered in this country, it's undergoing major changes.
Yes, it is.
Okay. These changes were just signed into law under the One Big Beautiful Bill Act. Again, I'm not here to politicize this. I'm here to explain what it means for you and for your family in a clear and calm fashion using trusted fact-based sources. So when we look at what just happened with the Big Beautiful Bill, according to respected legal analysts at Kroll and Moring, the new law includes historic changes to the Medicaid and Medicare funding. We already know that. We've heard about it, right? Here's what it looks like. Medicaid will face over 1 trillion in federal cuts over the next decade. States must now require 80 hours a month of work or volunteering to stay eligible for Medicaid benefits. Income-based copays may increase up to $35 per visit for some recipients. Eligibility will be recertified more frequently for let's see, Medicaid, I believe it is, and some states will reduce retroactive coverage. Okay. Another thing, this is an imminent threat. The rural hospitals who are that are already struggling could lose critical federal support, and this includes uh, Kiplinger's estimates that 300 plus hospitals many of them rural, are at risk of closing in the next couple of years. If if they don't get a state funding from their state, then they're going to close. They're actually up to 700 hospitals that are at immediate risk. When I say hospitals, I'm talking about hospitals and urgent care centers, things like that. All right, so why does this matter to everyone? Even if you have private insurance, why would it matter? You might even think, gee, this doesn't apply to me. I'm not on Medicaid. I'm not on Medicaid or Medicare. Well, here's the thing. According to Investopedia, these cuts could create ripple effects, and they will create ripple effects. There's no doubt because as you know, we have a family member. I have a family member that works in the hospital system, not just as an emergency room physician, but selling, because it's a full-time job, is creating equipment to diagnose and treat emergency situations, including cancers. If funding gets cut to these access to these type of things, well, now you're having hospitals closing. Funding is being lost, and the costs are passed on to the private insurers, which is going to raise premiums. So if that sounded like a weird sentence and a weird, like all of a sudden I went off on a different pathway, I understand. Because I sort of did, but we're gonna come back around. So when we have fewer people insured, emergency rooms become overcrowded. This is like the place to go.
Right.
They can't
Yeah.
turn you
They
away.
can turn you away.
No.
Yeah.
Longer wait times, and the system is stressed already. I mean,
Right.
can you even imagine
No.
if we have 300 or 700 closing?
No.
So your own insurance may get more expensive. It probably will get more expensive. And your local providers may cut services to balance their budgets. Now, it's already happening, but this big, beautiful bill, I'm not saying the whole bill is bad. I'm just saying that I didn't even say it's bad. I'm saying what's happening. I didn't say good. I didn't say bad. I'm saying that there are a lot of people, a lot of factors that are creating a risk. Okay, so the short version of this is this affects everyone, whether you're on a government plan, employer-sponsored coverage, or self-insured. Okay, so what's at risk? So if we look from a systems standpoint, we're facing reduced access to care, especially in rural and underserved areas, increased financial pressure on hospitals and doctors, potential closures of community health centers and safety net clinics. For Medicare recipients, reduced funding could impact future drug benefits and hospital reimbursements. These are all right-wing, right from the right. I could get from the left, folks, but it's more of a right audience here. So I don't want to be, even though I've pretty much my whole life been right in the middle. I see the Democrats' point of views and their values. I see the Republicans. I see others too. And I'm always in the middle because I try to see it all, take it all into consideration. But I'm pulling from the right because I chose to, because I want to make sure we ain't making this stuff up.
No.
Now, we have to go to break in a minute, but here's, if we just look at this, it to me is frightening. And really what it is if you just throw just you get like between 11 and 17 million people losing healthcare altogether, insurance. And I mean, not all of them are milking the system,
No.
and some of them are.
Yes.
But there are millions who are not. And I know I'm going to get some backlash on this, and it's not with disrespect that I say this to in either direction to those who are milking the system, in my opinion, or to those who believe all of them are milking the system when you're wrong and it's not a fact. Okay, we can pull the facts. You go in and look, you'll see, go to my website, carlsterling.com, and go click on the word uh, crisis. And then just go to crisis, health crisis, I'm sorry. And you'll see it all pop up. This is Your Health Matters, News Radio 570, WSYR. We'll be back in a minute. Okay, We are back. So it's scary to me, Do you have any comments?
Well, I've been talking to my doctor, your family member, and listening to the news, and it's all really scares me. It does.
Yeah,
It just, even my doctor said, You won't believe what's happening in this world, what's happening in the medical world."
yeah.
And he was like, "It's unbelievable." And he's a great doctor, and I'm very, you know,
He's a DO, right?
yeah, yeah, he's a
Yeah.
DO, but he's still,
We won't say names on here, but he's also a really good friend of mine.
he's a sweetheart, and I enjoyed going to him. um but he was telling me, he goes, and I bluntly said, "It sounds like they're trying to kill off people," and I'm not trying to be mad, and he just looked at me, he goes, "Yeah, it sounds like they are." And I it scared the daylights out of me. It really
Yeah.
scared me.
It's scary stuff.
It's like they're playing God, and I'm sorry, that's not their job.
Well, there's a lot to it, and we're gonna get to it. But for example, the person I know who's the deepest into this, who is actually he's with a company who makes these devices they literally save lives. Well, I don't know if when you saw him the other day, he told you there's a company that wants to buy them out
Oh.
and shut them down.
uh
You know
he
why?
didn't tell me that.
Yeah. The reason they want to buy this company out and shut them down is because then that equipment goes away, at least for now, and then they're not saving lives and they keep you sick. And this is not a conspiracy we're spreading truth.
And I'm very fortunate that my doctor was very open and honest with me. I'm
Yeah.
sure there's doctors out there that won't say a word about it.
And yeah,
And
a
that's,
lot of them do know, and I think some of them don't know. They don't know
well,
everything that's
that's
going
true.
on, but they're just in their tunnel vision. And there's certain people we know say, well, if insurance doesn't care about it, I don't care. Well, that's a horrible way to look at it.
Right.
And those kind of doctors really should have their licenses pulled.
And it's against their Hippocratic oath, to tell you the truth. If they're taking these
Yeah.
Hippocratic oaths, some of these doctors, even the ones that work in the insurance world, which there are a lot,
Yep.
they're breaking their own Hippocratic oath.
Well, with that said, my source, who's deep into this and dealing with FDA, CDC every day, and regardless of what you think of them, they're out there. He's also dealing with the AHA every day, American Health Association. They're like the NRA is. They're powerful.
Yes.
NRA's hugely powerful. Teachers Union, hugely powerful. AHA, hugely powerful. Here's another fact. I actually don't know the name of the guy, and if I did, I'd say it because I'd want to call him out on this. But there is a man who is a medical doctor who's the CEO of two of the very biggest health insurance providers in this country. And he has admitted nearly everything they're doing is completely against his Hippocratic oath he took.
Yes.
Now, I'm sorry, folks, if you disagree, it's okay to disagree. The fact is, that is the way it is, and I didn't make it up. We're bringing you facts, and I'm telling you, as we talk about every week, your health matters. It matters more than anything in your life. If you have a lot of money and you have bad health, I don't think you're going to be as happy as if you had less money and excellent health. Because, sometimes when people get too far and they're too far gone with the health and there's no turning back, it's really bad. And
Yeah.
you'd give anything and you can't buy it back, though. You could be a billionaire and you're not going to get it back
Right.
because certain things you can't buy back. So if there was ever a time to be healthy, it is now. So what can you do? Well, here's the empowering truth. No matter what changes are happening at the federal level, you can take steps right now to protect yourself and improve your health span. We already know this. We talk about it every week for a year and a half. I find it interesting. I do get, pretty good feedback on the show when I get feedback, which is hardly ever. So I think both listeners, hopefully they'll take action. And we do have thousands of listeners. I'm grateful for that. But here's a hard reality backed by Every credible expert out there, if you wait until you're sick to care about your health, it is too late. But, that's a general statement, but it's pretty much mostly true most of the time. Let's repeat that. It's worth repeating. If you wait until you're sick to care about your health, it's probably already too late. So let's take action. Eat real food. Reduce processed foods. Focus on fiber and protein. And make sure to drink enough water, especially in this heat and humidity we have.
Yes.
Move your body daily. Your body was designed to move. Your body thrives on move, and your brain thrives on movement too. It doesn't need to be fancy. Just be consistent. Maybe get up and walk. Okay. Get some high quality sleep. Manage stress. Your nervous system is your control panel, right? And stress is just good. Stress is good. We have to have stress, really.
I think it
But
motivates us.
yeah, yeah, it does. When I'm stressed about certain things, I actually perform way better. Like any kind of major project deadline, um, I wait till the last minute and I do a really good job. Isn't it funny? And even, we had my mom's memorial last weekend and burial. She died 9 months ago, but just to get everybody together in a timely fashion and have my son officiate, Reverend Dr. Nick, um, who did a beautiful job, and I spoke to his, oh, and you were there, yeah, and I didn't put anything together talk-wise till the night before because that's how I perform best. But anyways, that's a good kind of stress for me. Then there's the chronic stress. That's the stuff that's not going to be so good. Well, getting the stress under control, sleep is a lot of times a part of that because when we don't have getting enough high quality sleep is tough. Now, last week, if you go to carlstroing.com, that's Carl with a K. Um, Last week we did the last segment.
Right.
We did a thing about sleep and how to manage it. And I could talk a lot more about it, but just if you need to know how to manage your sleep, go there, check it out. All right. We can track your health if you know your blood pressure, your glucose level, your fasting insulin. That's a really big one. That's an important one that most doctors won't test for. Oh, why? Because insurance doesn't want to pay. Well, insurance is crazy. They don't have your interest in mind. Cholesterol, weight, stress load. We need to know these things in tracking our health. It would behoove you to ask your doctor some questions like, don't assume the system's looking out for you. It's not.
Nope.
We did an episode where we called it, I think, No One's Coming to Save You. You know why? Nobody is. And we were with, who were we with that day?
I can't remember. Don't ask
It
me.
was,
Sorry.
it was somebody who's got an edgy, like an attitude, and I
It
love the
wasn't
guy.
John.
Oh,
Was it?
Robert Lustig. I'm not coming to save you. You can't come to me and get saved in your health. You can't go to your doctor and get saved. Um, Trump's not going to save you. RFK's not going to save you. Your insurance company's not going to save you. Your surgeon's not going to save you. No, what do I mean by that? Your overall health is what we're talking about. They might save your life in some ways. People like Dr. Berry can call you out on a score. And there's a man who came in months ago who ended up having open heart surgery because of a test that Dr. Berry did, and he saved his life.
Oh, I didn't know that.
Okay, so in that case, yeah,
That's cool.
they can save you. But generally speaking, they're not going to save you. No one's going to come to your house, knock on the door, and go through your kitchen cupboards and save you from not, from eating the wrong stuff and trying to eat the right stuff. You need to take control. This is all about you doing what you can do if you really, care, I guess. And I think sometimes that's a tough one to measure too, because maybe we don't feel that bad right now.
Right.
And in 6 months, who knows what will happen? You could get a diagnosis of something. I'm not trying to scare you. I'm just saying you have to take control. You have to be your own first line of defense. You're listening to Your Health Matters on News Radio 570 WSYR, also on 106.9 FM. Thanks for being with me, Elizabeth.
You're welcome.
We got a lot more to talk about in the next two segments coming up after the bottom of the hour news break. Be right back.
Can I say something about healthcare? I mean, my stepsister,
Yeah. Please.
Teresa's daughter,
Yep.
skipped one mammogram.
Please. Let's do that. We're back. Okay. The Big Beautiful Bill Act now signed into law. Now that that's happened, healthcare will become more expensive, more administratively complex, and in some cases harder to access. I'm not saying this to scare you. I'm saying it truly from my heart to motivate you because, as I always say on the show, it ain't about me, it's about we. I mean, it's not that I don't care about me. I do care about me a lot, but I do try to put others first. But if I don't put myself first in line of, let's say, being healthy, fit, lean enough, where I'm not overweight and can't get around and stuff and pain all the time and whatever, I'm trying to manage my life in all aspects that I have control over the best I can help other people better. So I am trying to get you to get motivated because your health is your greatest asset. And unlike policies and programs out there, is something you control. You can't control the policies. You can't control the big, beautiful bill, whether you like it or not. There are a lot of good things in the bill. I didn't say it's a bad bill. Just need to make sure I didn't say it's bad. But this part of it is scary, this healthcare. You can control you through daily choices, personal responsibility, and a commitment to your own well-being. So, we're here to help you stay informed through the show and through our practice we have at neuromotor training, and hopefully, inspire you, cause you to build, maintain control over your habits in your life. This is what we do. So remember that the system may shift, but your health is still in your own hands. And I challenge you to rise to the challenge together with all of us. So moving right along, um, I know that you have something. I'd like you to share what's on your mind. It's really important.
Two things to share, actually. I'm sorry I threw the second one in.
That's good.
First of all, if you're having problems reminding to move, there's various devices, watches, your iPad, anything. But if you're sitting on the couch, it will go off because mine does. Mine's a Fitbit. I'll just say it right out loud. And I'm supposed to move 250 steps an hour. And if I don't move 250 steps an hour, it buzzes on my arm and tells me you have 167 steps to go. So there's no reason why I don't get up and at least walk around the house if it's raining outside. That's just one way of moving. Second of all, I'll tell you a health story. My stepsister um, was living in New York City, and she ended up moving with her fiance down to Florida. In 1 year, she didn't get a mammogram in that year when they were getting moving. When she finally got a mammogram, 1 year spanned. The second year, obviously, it was into the second year. She ended up having stage 4 breast cancer just in 1 year. And I'm telling you right now, if we don't stay on top of our health and try to fight what the system, things are going to get worse for everybody.
Mhm.
And she didn't do it on purpose. She just didn't have the time and,
Yeah,
but it's scary. 1 year.
it is.
And
She
she
passed
fought it.
away.
Yeah, she passed away in her early 40s. It was really a sad time for us. Very stressful.
Oh,
But
yeah.
she looked for all types of medical help. She had them, fortunately, her then husband, because they got married in the course of time, he had the source to help her, but it wasn't easy.
It's so sad. And so oftentimes there are things that you should be doing. Your doctor will either say, uh, you're not old enough yet,
Yeah, that happened to
or the
me.
insurance says that, and you need to take your control into your hands. If you're in menopause, if you're female, you're in menopause, you got to get those DEXA scans. I don't care if you're 40, 60, or 30. Menopause happens at different times for each woman, right?
Yep.
And you got to get in there. I mean, you have a story. I want to talk about it just real quick. You got denied DEXA scan from a doctor
Well,
because you're not 60.
Well, yes, but the story is for 2 years they were asking me for it, and I said no because I had 20,000 other doctor's appointments, not 20,000, but a lot of doctor's appointments, and I just didn't want to do another DEXA scan. When I finally asked for it, they said no, you're not old enough. Two doctors. One doctor said no, the insurance won't cover it right now, you're not old enough. And the other doctor said, well, you have preconditions, but you didn't break a bone, so you don't need a DEXA scan. And then
And then what happens is you finally get one
one
and you've got,
osteopenia in my hips.
yeah. So there you go. And if you don't catch that and know about it, then it's harder to take care of it and manage it and reverse it. By the way, we do reverse things. Got another score that came in recently of a gentleman who gained 10% bone mass. He's 82. So,
Yep.
our system works. Your doctor needs to know about it. You need to come check it out if that's you're so inclined. All right, we're going to get through some more things here. So let's talk about your health sovereignty. What does that mean? Well, basically, it means taking full ownership of your health trajectory, regardless of government programs, and viewing health not just as treatment, but as a daily set of choices. Here are 10 critical areas that you can control what you put in your mouth. Okay? You already know, we talk about all the time. I'm not going to go into details. You already know what to do. Now go do it. Move daily. Sleep well. Learn to manage stress. Go to my website, carlstoring.com, Carl with a K. Check out the breathing exercises there. Maybe practice some mindfulness, social connection. If you're missing that, we have that here. Seriously.
Yep.
Preventative care with screenings, tracking your blood pressure, glucose, fasting insulin, etc. And if certain screenings you'd like to do aren't covered, maybe it's not within your means, but please, I implore you, if it's within your means, then you better dig into your pocket, pay a couple $100 for that DEXA scan or maybe the $700. I know it could be out of reach for some people. I get it. There are many times, even a month ago, that would have been out for me. Technically, I'm self-employed, so income is very variable. But do it. Save the money. Do it because it could save your life. Understand, you have to invest in your health. That's what I'm saying. You need to invest in you, and it can involve some out-of-pocket costs. Understand your insurance plan and what out-of-pocket costs there are. Be prepared for an emergency. Know where your local hospitals, urgent care, and local clinics are, and access to pharmacy. I'm sure most of you do, but we have pharmacies closing a lot.
Yeah.
Yeah, the Rite Aid's gone up by me. There's another one closing.
There's
I
one
never
right
went.
next to us, right next to us
Yep.
on closing too.
So create a personal health network, maybe some trusted providers, support from your family. And if you can't get it there, I know it can be tough because not all family wants to help other family or they're just not believing that it matters. Well, don't be an island. Call us up, come in, we can talk. Be your own health advocate. Review your medications and what they do. Get self-educated on that. Have a contingency plan. Maybe if you're in a work situation, you create an SHA account or do some telehealth. I don't know much about that other than it might cost a little less, but I don't know. HSA is a health savings account. And our urge in really in a call to action is to encourage listeners to do one health audit this week. Pick one of the areas I mentioned and take charge of it. And then we're going to continue the conversation in future episodes, but developing one skill at a time, making one choice at a time. We are already at the end of the third quarter. I can't believe it. Now, what's the next one we're going to talk about? What did that
Oh,
say
wait.
about on that page?
Health.
Health sovereignty, what you can do to control when the system changes, and that's happening with the big beautiful bill. Okay, this is Your Health Matters. My name is Carl Sterling. I'm with Elizabeth Elizabeth Brusa. We're on News Radio 570 WSYR. We'll be right back. Here we go. Welcome back to Your Health Matters. If you're just joining us, we've been discussing some major changes in U.S. healthcare, particularly how the newly passed One Big Beautiful Bill Act could impact coverage, access, and costs for millions of Americans. Now I'd like to shift gears from policy to personal power. Because while we cannot control federal budgets or insurance policies, we do control something far more powerful, and that would be our daily choices, our habits, and our mindset. So our health sovereignty is it's in our own hands, largely. Let's talk about again, what is it? It's the idea that you are the primary leader in decision making in your own health journey. And it means no matter what changes happen to Medicare, Medicaid, or private insurance, you are not helpless. You are informed. You take action by being proactive. You're equipped to make the best choices possible. Okay? I'm going through some notes here because I already said some of that. And here's what I'd like you to do is, again, choose one of the 10 areas we talked about, audit yourself. See where you stand. What's one action you can take this week? Maybe you plan your meals in advance. Maybe you schedule a checkup you've been putting off. I've got to get a abdomen scan. I have a script for it. You know, my mom passed from cancer, which was stage 4 pancreatic that metastasized to 6 other areas in the body in like a 2-month period. It was so fast that I'm just going to have a preventative thing, and I'm going to pay a few $100s for it. It's hard for me to do that. I don't have much money, but I'm going to do it because I don't want to pay the price down the road. If I know something now that'll help me make tomorrow better and years ahead better, I'm doing it. So I'm doing this check. So maybe that's something you want to consider doing as well. A checkup you've been putting off. Maybe you download a breathing app and commit to using it. Whatever it is, just do it. And then tell someone about it. Invite your loved ones, your kids, your coworkers to do the same if you feel it's appropriate. I mean, some people don't want to know anything about this stuff. But align yourself with people who would, let's say, who would be aligned with you on this, and you could have somebody to, yeah, like you and me. We talk about it every day, all day, Health sovereignty is not political. It's not partisan. It is personal and it is powerful, and it starts with you. So that's the end of most of my notes, but I do have a few more here I just want to talk about. The cost of waiting. What happens when you delay health decisions? Let's get real serious. The hard truth is every day you delay a health decision, whether it's getting a screening, changing your diet, or dealing with that nagging pain, you're taking a gamble. All right. In today's healthcare landscape, the cost of that gamble is getting higher every single day. If you catch it early, you get better. Cheaper out, it's going to cost you less to get better. And time, energy, money. You wait too long, you're going to pay with time, money, and maybe even your life, right? I'll give you some examples based on hard numbers from Investopedia and Kiplinger. A routine doctor visit might cost $150, but an ER visit for the same issue could be $1,300 or more. Managing prediabetes with lifestyle changes might cost $300 a year, but a full-blown diabetes with complications up to $16,000 per year in meds, devices, and hospital visits. A colonoscopy costs $800 and takes a day. Colon cancer treatment? Well, if you let it go, you don't get checked, over $60,000 in weeks of chemo, radiation, and surgeries. These are just some of the costs of waiting. Boy. Well, I mean, I'm not afraid for me because I'm doing what I can. I'm willing to invest in my health. I see one of the things I'd say that bothers me most are people who I know have plenty of financial resources who are still waiting for insurance to cover something. And it just breaks my heart because I feel like they're not listening. I don't know what it is. I don't know. It seems to be all over the place too. It's not just like a generational thing. This is like a lot of people. Well, it's not my responsibility. Well, yes, it is because nobody's coming to save you. Nobody.
I know. It's heartbreaking.
Nobody's coming to save you. Let's see what else we got here. Okay, Medicaid and budget. Budgets for Medicaid, Medicare are shrinking. There's more red tape. And now I think you're going to have to qualify every 6 months. Well, I can tell you that qualifying for Medicare takes 6 months. I know this firsthand, not from me, from family, and from my friend Emily. If you have to do it every 6 months, you're always going to be trying to qualify for it. It's just unbelievable. Hospitals, especially rural ones, are already strained. Let me just say this very plainly. If you wait until you're sick, the system might not be ready or able to help you. Again, this is not political. This is a fact. Okay? These are facts. We had a client. We're going to call him Jim. He was feeling tired for a few weeks, but he told himself it's just stress. 3 months later, his legs started swelling. He finally went in, got checked, early stage heart failure. Fortunately, he caught it in time, but he told me, Carl, if I waited another month, I'd probably be in the hospital or dead. This is not a rare story. We hear this all the time. I mean, not in my clinic, we just hear it out there in the world all the time. Waiting is normal, but the consequences, they're anything but normal. So my challenge to you today is, again, pick one health decision you've been putting off, a checkup, a lab test, a colonoscopy, a mammogram, starting the workout routine that you keep promising yourself you'll do. Do it this week, schedule it, show up and commit. Every day you wait is a choice. And today I want you to choose action. So your health doesn't wait, and neither should you. And with that, I want to just talk about a special event we have coming up, July 30th. We actually were full,
Yes.
but you can email me. We might be able to create a spot for you. Okay. So what we're having is on July 30th at 11 a.m. Something incredible is happening in our clinic. It's the Neuro Rehab Virtual Reality System. I bought it. We're using it. We're going to do it. It's going to be it's not just for the sake of technology. This is real-time, immersive, cutting-edge neural rehab that helps rewire your brain, improve balance, coordination, reaction time, memory, and functional movement, all in a way that's engaging, challenging, and most importantly, backed by neuroscience. It's not just a video game, it's targeted neuroplastic training of your brain designed to shape your brain. People who will benefit this are all humans with a brain, all people, Parkinson's, MS, stroke recovery, brain injury, concussion rehab, older adults, let's say, working on cognitive function and fall prevention, and even high performance athletes, high performance aging folks, for those who want to stay sharp, get sharp, stay sharp, focused, and mobile for life. So go to carlsferring.com. That's Carl with a K. Check it out. Go to the whatever I said earlier when I can't remember the name of it right now, the
Oh God.
health crisis,
Crisis. Yeah.
to look at the resources. I should say the references I used for today's facts, as scary as they are, they came from credible sources and they're not made up. Elizabeth, thank you.
You're welcome.
Always good to do this. I like doing this with you,
I like
even
doing
though I
it too.
hogged the microphone again. This is News
Sorry.
Radio 570 WSYR. Your health matters. Be kind. Use your body, move your brain every single day. Thank you.
I'll go get Rosemary.